Hi everyone, my name is Yumiko Helly and I'll be discussing today the provider and policy stakeholder perceptions of an organ transplant program for undocumented patients here in Illinois. So the undocumented immigrant population in the US is making up a growing portion of the uninsured population, which leads to inequitable healthcare access, particularly in organ transplantation. This just leads to worse health outcomes and burdens on the healthcare system. And to address this inequality, the Illinois Transplant Fund, or ITF, is actually providing health insurance premium coverage to aid this population to gain access to transplant outcomes. So the purpose of this study is really just to understand the perspectives of providers and policy stakeholders that are involved in the organ transplantation process for undocumented immigrants. So we had a variety of medical and policy key stakeholders that we interviewed, and you can see below all the different roles that they play. All these interviewees were involved in kidney transplant programs in the Chicago area from a variety of institutions, and our final N was 13. We conducted semi-structured interviews with all 13 participants over WebEx, and the interviews were audio-recorded and transcribed. And we used qualitative data analysis software and Vivo to identify themes and sub-themes. These were the main 5 themes that we identified, and we're going to be going into more of the themes specifically and their sub-themes in the following slides. So as far as barrier to care, there was a significant amount of barriers that the participants identified, fear being one of them, the fear of being flagged or deported. A quote that was from one of the interviews was, the undocumented population is afraid to go through this process because they are probably scared that we are going to send or call someone and send them back. Communication, education, awareness, finances, transportation, social support, current policy, disease, geography, were all other barriers, as well as we identified the contrast of barriers, the difference of barriers between undocumented and documented populations, as well as solutions to barriers, how healthcare workers and patients have found ways around these barriers. As far as effects for barriers as a theme, we found 3 different sub-themes within that theme. Patient well-being, how these barriers affect the patient physically, emotionally, and mentally. An example of a quote is, basically the patient can die for not having a transplant or getting worse and have to be in dialysis, and it's going to decrease their quality of life because they are going to get sicker. Interpersonal impact. This doesn't just affect the patient, it affects their family due to work, childcare, or caregiver burden. And again, the contrast between how these barriers affect the undocumented versus a documented population. Another theme we identified was healthcare professionals. We just kind of talked about their perspectives, feelings, their thoughts about the transplant process and how it affects their practice. Transplant outcomes was another significant theme that we found in terms of health outcomes, just the physical medical outcomes of transplant on these patients, how life changes with a transplant. These patients can go on and get degrees and work and things like that. The ITF specific transplant outcomes with patients that were supported through ITF, and again, the contrast between the outcomes of undocumented versus documented patients. And the last theme we identified was possible interventions and policy changes. There were 2 major sub-themes, global policy changes and ITF-specific policy changes. So global changes were just kind of comprehensive changes, legislation or health policy that participants would like to see in organ transplantation for undocumented patients, and ITF-specific policy changes. So overall, there's still a significant amount of barriers that exist for undocumented patients, and these barriers really carry over to clinicians and how they're able to care for their patients. But we found that once undocumented patients receive transplant, it seems that these patients generally have comparable outcomes to the general population. The interviewees supported program expansion and comprehensive legislation to increase access to kidney transplants, and the interviewees expressed the significant benefit of transplantation over dialysis regarding improved quality of life, health outcomes, cost effectiveness, and relief of healthcare system burdens. So I'd really like to thank DePaul University, the Master of Public Health program, for having this conference, the Gift of Hope for funding our study, the Department of Preventative Medicine at Rush, and Dr. Brittany Langmaya, Dr. Elizabeth Lynch, and Nancy Cortez for working with me on this project. And here's my contact information if you want to contact me with any questions, comments, or concerns. Thank you.